Hi, I'm Maria Bernstein, and I'm here to answer the question, does telehealth improve anticoagulation management in patient service centers? This work has been currently published at the Journal of Thrombosis and Thrombolysis in January of 2020. We look at 8 warfarin patients on maintenance dose therapy with TTR of less than 65. We incorporated a telehealth technology for patient evaluation and management. We measured the TTR before and after the telehealth pilot, and we've seen a significant improvement in TTR utilizing the telehealth over usual medical care, and that's about 45.73%. Anticoagulation care is assessed by measuring the percentage of time in therapeutic range in patients receiving warfarin. It is an estimation of time a patient spends within their target INR, which is an international normal ratio range. INR is a blood test to measure the therapeutic level of warfarin in a patient. TTR is a linear interpolation, also known as Rosendahl methodology. It can be calculated at the individual level or center level. So let's explore why TTR is important. A 10% improvement in TTR has been associated with a 10% reduction in adverse events. Optimal anticoagulation management over usual medical care should prevent 7 myocardial infarctions, strokes, major bleeds, or death per 100 patients per year. Also, the Center for Medicare and Medicaid Services defined a benchmark of TTR for anticoagulation management. CMS defined TTR of greater than 65 as good to excellent anticoagulation care. Anything that's 60 to 65 needs improvement, and less than 60 as unacceptable. For methods, the pilot telehealth was designed as part of the anticoagulation management service. The program consisted of teams of phlebotomists performing point-of-care testing at the patient service centers in Long Island, and that is our originating site. Evaluation and management was conducted remotely by anticoagulation nurse practitioners in Staten Island University Hospital, and that is our distant sites. 8 patients were selected on a rolling enrollment with individual TTR of less than 65, and we monitored these patients over a 40-week period of time. INR results were documented and recorded at each visit in an anticoagulation decision support program and electronic medical record. We look at the individual TTR metrics, usual medical care, and compared it to the telehealth pilot project. For example, looking at patient number 1, this patient had an INR range of 2 to 3. He's 81 years old with a diagnosis of atrial fibrillation and PFO. This patient had 27 visits during the duration of 40 weeks and had a TTR before the telehealth of 18%. TTR after telehealth was measured and it was 75%, a significant improvement in time and therapeutic range. This graph shows each patient's TTR or individualized TTR before they enter the program as seen in purple, after the 40-week telehealth program in red, and the improvement in TTR in orange. The horizontal line represents the CMS benchmark of good anticoagulation care with a TTR of 65%. Most patients exceeded this threshold and showed a significant improvement in their anticoagulation care. Before the patients entered the telehealth program, they had a mean center TTR of 32%. After the 40-week period of telehealth program, the patient showed an average of 77% TTR, which is above the threshold of 65%. This shows a 45% improvement or delta center TTR during the program. These results are greater than the hypothesized 5% improvement we predicted for the study. In conclusion, incorporating key elements of anticoagulation management service into our TeleAx INR pilot program showed a center-based improvement of TTR of 45%. This is a proof of concept, which has a potential to promote workflow efficiency while decreasing the time and cost of care. However, it needs further investigation and validation. Using a telehealth INR model is a new, innovative approach for anticoagulation management service that has potential to yield excellent quality metrics over usual medical care. Thank you for your attention. If you have any comments or questions, please contact me at this number and this email.